Dr. Teresa Lyons here. This week's Ask Dr. Lyons video is a bit different. I keep getting lots of questions about the new science report that came out from Autism Speaks. So I printed it out and I'll walk you through it and answer your questions. Alright, so this is what Autism Speaks finds important about autism and health. So they feel epilepsy, GI disorders, disrupted sleep, feeding, eating issues, mental health, and premature death are the most important issues facing those with autism today. So the great thing about this report, how it opens up, is that they're now considering autism to be a whole body disorder. We now know, and this is a quote, we now know beyond doubt that for many people autism is a whole body disorder. And they put two scientific quotes there. It says it also includes seizures, GI disorders, sleep disturbances, eating and feeding challenges, attention deficit and hyperactivity disorder, anxiety, depression, schizophrenia, and bipolar disorder. So it's really assuring to know that the largest autism organization out there considers autism to be a whole body disorder, which it is. And if you ignored all of those other comorbidities that I just listed, your health or your child's health would really suffer. So all of these things that encompass autism, it's not just this brain up here, it's a whole body disorder. It's really important to take all of that into account when you're healing autism, which is totally possible, by the way. The most recent research found that the average lifespan of someone with autism is half that of the general population. That is hugely disturbing. That's just not right. That is not right for any child, for anyone, to have that much of a shortened age. Autism itself is not a cause of premature mortality. Rather, it relates to many of the medical and mental health conditions in this report, most of which are treatable or preventable. It's absolutely, utterly amazing how people with autism have just been left to suffer with these comorbidities, with things like GI disorders, epilepsy, feeding, eating issues. It's not right. So this report is definitely a good first step. So I'll quickly just run through some of the things that they said and add a little commentary, of course. So autism and epilepsy. Autism affects a fifth to a third of people who have autism, compared to an estimated 1 to 2% of the general population. Unbelievable. A review of studies on children with autism, epilepsy, and sleep disorders suggest a vicious cycle, with uncontrolled seizures affecting sleep and disrupted sleep increasing seizures. So yes, if your child is suffering from any type of seizures, make sure you get in front of an expert. So they go on to talk about treating epilepsy in patients who have autism follows the same principles as treatment of epilepsy in others. I would be careful with that. I would make sure that the person you're seeing to treat epilepsy is also hugely familiar with autism. Because again, Autism Speaks just said in the beginning of this document that autism is a whole body disorder. So we need to be very careful when we start saying, okay, yes, there are all these different issues, and just treat each individual issue as if there is no autism. We have to be really, really careful to include the whole entire body when treating these different issues. Now, everyone's favorite topic, autism and GI disorders. So, quote here, children with autism are nearly 8 times more likely to suffer from one or more chronic GI problems than are typically developing children. That is just unfair for our kids. Totally not right to be having GI problems. So what's GI problems? GI issues include frequent abdominal pain, gaseousness, diarrhea, constipation, and painful stooling. There's a study that also linked chronic GI issues with increased severity of autism behavioral symptoms, including repetitive behaviors, social withdrawal, hyperactivity, and irritability. That is just not right for our children with autism to be experiencing so much more GI problems than a typically developing child. Those things can be addressed. GI discomfort, GI constipation, things like that, that's not just autism. Your child with autism should not have to suffer through any of these GI disorders. Abdominal pain, gaseousness, diarrhea, constipation, and painful stooling. That's not autism. And here's another quote. Research has shown that spikes in toxin-producing bacteria in the intestines could directly affect the brain via the vagus nerve that runs between the digestive tract and the brain. So it's great to see that the cutting-edge research that is out there about autism and out there about the microbiota is really being reflected in this document. At least it's starting to. Now in 2010, the journal Pediatrics published the first guidelines to help healthcare providers recognize and treat GI problems in children with autism. It's unbelievable that it only took to 2010. That's a few short years ago. So many people with autism suffered through these GI disorders, and there were no guidelines whatsoever to help with treatment. And what I find disappointing about this summary on autism and GI disorders is the lack of relating the GI disorders to the whole body disorder. Again, that's what was said in the beginning of this document, how autism is a whole body disorder. Constipation just doesn't affect your bowels. It affects your whole entire body. So for example, they say constipation, they've summarized to add fiber or give medication. And there is so much more to a proper diet than just adding fiber. And I'm glad diet's mentioned, but again, in your typical population, if someone is suffering from constipation, yeah, okay, start adding some more fiber. But when someone has a diagnosis of autism and constipation and all these GI disorders are known to have such a high prevalence, adding fiber or taking laxatives, as also suggested, is really not going far enough to treat autism as a whole body disorder. It's great that they talk about how constipation could be from abnormal gut motility, which is so true and is not well known at all. Chronic diarrhea, they say, could be due to intestinal infection, immune dysfunction, inflammatory bowel disease, irritable bowel, celiac, gluten intolerance, food allergies, lactose intolerance, or excessive consumption of certain foods or drinks. Treatment depends on the cause, they say. For instance, dietary changes can ease diarrhea due to excessive juice, food allergies, lactose intolerance, or celiac disease. That is a great first step. So Autism Speaks is noticing how dietary changes can really help those with GI disorders with autism. So it's great to see that there. They also talk about gastroesophageal reflux disease, GERD, and the casein and gluten-free diets, but they don't have any actionable information. As a parent, I want to know what to do. Don't just tell me that it's a problem, because I know that already. And on page 7, they have a small 2-paragraph section on probiotics, and it's mentioned very briefly, but there's no specifics again. Autism Speaks is actually funding some of the pivotal research on autism. It's amazing. So there's research on autism and the microbiota, and then it links back to the GI issues and behavioral symptoms. They funded the B. fragilis research in 2013, which was absolutely pivotal. So I'm not quite sure why there isn't more details and specifics on some of the fantastic research that Autism Speaks has funded. It left me kind of confused. Okay, let's get to autism and disrupted sleep. Over half of children with autism, and possibly as many as 4 in 5, have one or more chronic sleep problems. These problems include difficulty falling asleep, frequent and prolonged wakening during the night, and extremely early rising. Sleep issues in those who have autism go hand in hand with daytime behavioral challenges that interfere with learning and decrease overall quality of life. Yeah, when you don't get a good sleep, you don't do well in school. You don't learn as well as you could. We know that. There's even research that has documented how the actual symptoms of autism increase in severity when the child doesn't get enough sleep. So we've got to take it a step further. We know sleep's a problem, so we have to attack sleep as a whole body disorder and start focusing on getting our children to sleep, because then severity of autism decreases. It's amazing when your child starts sleeping through the night. They're just wonderful. They can start blossoming into the person that they are. It's unbelievable. So they have a list here. What causes autism-related sleep problems? Genetics, epilepsy, anxiety, less REM sleep, and melatonin issues. Sleep is such a problem in the autism population that has a huge impact on a person's actual autism symptoms and the whole family. I do have a 90-minute webinar where I teach a 2-step strategy on how to get your child to sleep through the night. So if you want to learn more about how to actually get your child to sleep through the night, I had that issue as well. My child did not sleep through the night. She sleeps a wonderful, blissful 10 hours a night. It's absolutely wonderful. So just go to autism.net, AWETISM.net, and sign up for my emails so you get notified when I'm giving a webinar. Autism and feeding issues. A recent review of diagnostic records found that an estimated 70% of children on the autism spectrum have feeding and/or eating problems. 36% of these had problems classified as severe. And these issues may have causes including sensory aversions, anxiety, and rigidity. Many children with autism also have motor issues that involve difficulty with chewing and swallowing. Still others have digestion problems such as slow stomach emptying. All of this stuff can be addressed when you look at autism as a whole body disorder. There's no reason to have your child suffer through symptoms like this for the rest of their life. There's no need. It's great that it's now being acknowledged, because before this was not scientifically acknowledged. It was not. Now it is. So now things must be done to address this in your child. And again, there's not that much actionable steps like, okay, I have this problem, what is it that I can do? This document, it's just really summarizing the problem. But by them stating that these are the actual problems, hopefully it takes you one step further to a solution. They also discuss issues with overeating and obesity, and they unfortunately quote here, investigators found that the likelihood of being overweight or obese increased with the number of psychoactive behavioral medicine a child or teen was taking. Some of these children were taking as many as 5. So what do they offer as advice, as what to do? I mean, when I read a document like this, I just want to know, okay, what are they saying that I can do to take action? And unfortunately, they say food restriction and increased exercise can prove particularly difficult for some people who have autism. When behavioral strategies fail, many parents find themselves in the difficult position of choosing between their child's physical health and a behavioral medicine that improves their child's ability to function on a daily basis. Look at the problem as a whole body disorder, like they say to do on page number 1. They also talk about pica. Thankfully here, they conclude that medical causes can include nutritional deficiencies in iron or zinc and/or infection with intestinal parasites. Thankfully, they conclude medical causes can include nutritional deficiencies in iron or zinc and/or infection with intestinal parasites. So there's an action step that you can take. So if your child is having this problem, make sure you analyze their digestion. Work with a specialist. work with implementing a special diet because it makes a big difference. Autism and mental health. Epidemiological studies suggest that between 54 and 70% of people with autism also have one or more other mental health conditions. So they have these ranked in order of estimated prevalence. Attention deficit and hyperactivity disorder. A few years ago, you could only be diagnosed with either autism or ADHD. That has since changed, so you can now be diagnosed with both autism and ADHD. The next on the list is anxiety disorders, followed by depression, schizophrenia, and bipolar disorder. These are all very serious health concerns that need to be taken into account along with autism. And finally, the last section, the one that really worried me the most, autism and premature death. So they write, 2 new large studies provide compelling evidence that, as a group, people with autism die younger, as much as 36 years younger than those in the general population. This research also makes clear that autism alone is not driving the premature mortality. Rather, leading causes of death include many of the medical and mental health conditions described in this report, further highlighting the urgent need to recognize and address them. So they conclude, attention must now shift to addressing the preventable and treatable issues and conditions that drive these disturbing statistics. Yes, and that is why special diets are so important to those who have autism. Digestion addresses your whole body. It's absolutely vital to have optimal digestion to be functioning optimally. I completely agree with Autism Speaks when they say attention must now shift to addressing the preventable and treatable issues and conditions that drive these disturbing statistics. Too many of our children with autism have to suffer through life with things that actually are treatable. They are, and special diets is really so helpful in having your whole body performing optimally. If you have any specific questions about this report or any comments, feel free to leave them below. I'll certainly get back to you about them.